Hi, I'm here with Dr. Teresa Frankovich, April 3rd, 2020 media availability. How many people in Humboldt County are isolated and how many are quarantined? And can you tell us what the difference is?
Sure. So the difference between these two, I know, is sometimes hard to understand. Isolation refers to an individual who is symptomatic and is either presumed to have the infection or suspected or confirmed of having the infection. So that individual is in isolation. That's the term we use. Quarantine is for individuals who are not having symptoms, but we have reason to believe have had an exposure. And those individuals then we label as quarantined. And in effect, those two things look the same. People are the same requirements are essentially in place, that they stay home, and that they even, for individuals who are symptomatic, we also ask them to socially distance within the home. In terms of numbers, what I can tell you is that we have a large number of people who are under isolation or quarantine, because again, as we do these contact investigations, we discover a large number of people who had exposures that we may have concern about, or potentially a large number for each case. And we want to make sure that those individuals are restricting their activities as well. So there's really no way to give a daily number, because each day we're adding people to that list when we get positive results, and we are pulling people off the list when they complete quarantine or isolation.
So if people with confirmed cases in Humboldt are quarantined at home, what is to stop them from going out and getting things like food or other essentials?
Sure. So there are a few things that I can say about that. One is that our staff obviously advises them about what the issue is. At this time, we are actually issuing written orders to that effect as well. And we do have the capacity for law enforcement of those orders if people are not adhering. And so, those are the ways right out of the gate that we have to help with this, because, we realize how important it is, and we convey very strongly to the individuals involved how important this is as well. If individuals are in a place where they are asked to be isolated or quarantined at home, and there are issues about them getting resources they need, such as medication or food, we are able to sort of work with them on that as well.
So how is DHHS advising patients with confirmed cases when they live in a household with other family members?
So social distancing is advised for individuals who are ill with their household members. And in fact, that would be recommended whether or not you are in isolation or quarantine. We recommend that all people, if they become ill, stay at home, and they try and socially distance within the home. That's easier for some people than others. For some people, for instance, two people living in a household, they may have a very easy time remaining basically 6 feet apart, sleeping in separate areas of the home, and then in instances where they overlap, doing frequent cleaning, that type of thing, to try and reduce exposure. In an individual case where there might be many family members living in that household, that becomes more difficult. And so we do talk to people about what's practical in the setting they're in.
Are there any children in Humboldt County with the coronavirus at this time, and what treatments are they receiving, if so?
Sure. So one of the reasons we're not yet reporting age groups on cases is because we don't have enough cases right now to have good representation in each, and we really don't report on small numbers. So what I can tell you is that we only have one individual hospitalized at present, and that is not a child.
Now that there's evidence of community spread, will that change the testing criteria, and if so, how?
Well, it doesn't change the criteria in the sense that we are still trying to target testing to people who are high risk, either by their occupation or by their health condition or by their living situation. So for instance, people who live in a nursing home facility or in a jail or in some other congregate setting that could put other people at risk. So we still prioritize all of those individuals, including healthcare workers and first responders. We have also been trying very hard to test everyone we can in public health who has symptoms very consistent with COVID, recognizing that that's going to miss people with very slight symptoms, but it's those individuals, if there's a clinician concern, can be tested through commercial labs. And then the other thing that we're doing is basically using the lab as a tool to help us with case investigation. So if we identify symptomatic individuals, we may be trying to test those individuals as well who are contacts of a known case, just to establish that. So we still have priorities to do that. If at some point we have testing capacity within the county to just test people who are either very mildly symptomatic or people who are not symptomatic just for surveillance, we would do that. But right now we don't have that capacity.
Okay. As we do see more and more people contracting COVID-19, will public health be releasing more information about the gender, age, or location of the various patients?
Sure. So, and I think people watching the data that we're putting out can see that we are putting some information about area in terms of where cases concentrated right now. Again, as cases increase, we have more of an ability to sort of distribute that across regions, and we'll make an effort to do that. Gender, we're already putting out. And then for age, once again, as we develop a larger case count and those age groups in the typical way we present them are represented well, we can go ahead and do that. But what we don't want to do is, for instance, put one case in pediatric age group, for instance, if there's a single case, or one in a 80 plus, if there's a single case, again, because it just becomes easier to identify individuals. But we are giving information on an average age of cases presenting, and we'll adjust that as we have more identified positives.
What has been effective to help rapidly create hospital beds and increase capacity locally?
We have been working really hard on this front because it's a critical piece of our response. So there's a whole segment of public health and the EOC that are really devoted to sort of the situation as it is now, and a very large segment dedicated to what it will become. So we are working hard at reaching out and working with hospital partners, other partners such as nursing home facilities, and other congregate settings to figure out what might work in terms of accommodating an increased demand for beds that can provide medical care. And the hospitals have been working intensively within their own walls at looking at what their normal baseline capacity is and how they can increase that within their own walls by changing how they do rooms, how they share rooms, where they put beds, how can they cohort patients so they can increase ICU capacity. All of those things are being done within those walls. And then we're also looking at what alternate care sites we might develop in order to provide care outside the hospital wall and outside traditional settings such as a skilled nursing facility. So those are all a piece of the plan. And then underpinning all of that is work on developing our workforce, repurposing physicians who may be able to go from outpatient care to inpatient care, and looking at people who are in the area and not currently doing medical care in terms of what they can offer as well. So it's a very large piece, and there's a lot of work going into that.
Great. And then the last question, how is the mental and physical health of doctors, nurses, and other hospital workers being supported?
Well, I think it's a great question, and much like we're advising the general public, it's a very stressful situation for everybody, and we really encourage everyone to sort of find stress relief where they can. For some people, that is time that they can spend outside. For some people, that is time that they can sort of tune out and do something different with, reading or electronics or whatever it is that they do. But I think that it's going to become an increasing problem for us all as we move through this. And so I think it's good for people to think about what they can do to reduce that level. And then what they can do in terms of accessing any mental health resources. And we'll be working on that component as well.
Excellent. Thank you so much.
Thank you.